What does the color of your urine tell about your health? If you ever liked science as a subject, you'd remember the little experiments that we all used to do that made us believe in the fact that science is really cool. Like the litmus paper test, where red litmus paper would turn blue if the solution was alkaline or basic, and a blue litmus paper would turn red if the solution was acidic. The color change would tell us the nature of the liquid, and we could then classify it more appropriately. That's the beauty of science, which is used in multiple ways to detect changes. An example is the medical field, where doctors use changes in color amongst other physical signs to diagnose different diseases, such as the change in color of one's urine. If you've ever taken a urine test, you would understand how uncomfortable the concept is, but if you knew the many ways in which urine tests are helpful, you would understand why it is one of the most frequently used tests in the diagnosis of diseases. And that's what we're here to do today. Because in this video, we're going to help you familiarize yourself with different colors of urine and what these colors may be trying to tell you about your health status. So what color of urine means you're in good health? Is it watery urine, pale yellow urine, or dark brown urine? Or can all three of these mean different things? Stay tuned to find out. But first, let's try to understand why a urine test is so important and why many health professionals all over the world rely on it. The urine our body expels is a collection of waste products that are no longer required, and a byproduct of many body processes that take place inside the body daily. Most of the urine is made up of water, and that should explain its liquid form, but it also contains urea, sodium, potassium, chloride, uric acid, creatinine, phosphates, and many other compounds. It also contains some trace amounts of urine, but the keyword here is trace. Because if our urine contains a great amount of protein, that means there's something wrong with our kidneys because they're not supposed to let all this protein go to waste. Similarly, when the composition of different substances in the urine is different, it gives the urine different colors, which helps professionals understand what's wrong. So, do you remember that urine test we talked about before? That sample is tested and analyzed to check for any abnormalities that can help in the diagnosis of a disease. And the process where this urine sample is analyzed is called urinalysis. In a urinalysis, only the color of the urine is not under observation, but also its volume and its specific gravity, which also means its relative density, are considered. You may think this is all a little too much, but when we tell you that urine samples are put under microscopic review to find out what's wrong with the body, you better believe it, because that's exactly what happens. Sugar molecules, proteins, and even hormones are checked with the help of different clinical tests when a urine sample is being tested. And all these tests help professionals in diagnosing a patient properly. Now we know it's not possible to collect urine samples in your home and examine them at a microscopic level. But what you can do is check the color of urine and look for any red flags, or in this case, any colored flags, because these warning signs displayed by urine come in many different colors. So, let's get down to it. Number 8. Clear urine. You might think that clear or transparent urine is a good sign because that just means that you have been drinking enough water and there aren't any problems with your body, right? Wrong. While clear urine may seem like a good sign, it is not something to be ignored. There is something like a little too much water. So if you keep expelling clear urine out of your body and do it very often, you might want to stop drinking too much water. Because just like everything else, our bodies need a balance of water and salts. And that's not all, because if you keep overhydrating your body, it could be linked to chronic conditions such as kidney problems, like an infected kidney or diabetes. Number 7. Lemonade-colored urine. So if drinking too much water is bad, how do you know if you're drinking just enough water to make sure you're hydrated, but not so much that your urine is clear? Well, one sign can be urine that resembles the color of lemonade, because that pale yellow color is where the optimum urine color lies, which indicates good health. So if this is the color of urine, you're lucky you're in good health. Nothing to worry about here. Number 6. Dark amber or dark yellow urine. While pale yellow urine is a good indicator of health, a slightly deeper yellow or dark amber colored urine might tell you that you're out of the safe zone. Let's put it this way. If clear urine meant too much water, It means that water was the biggest constituent of the urine. And if a slightly pale yellow colored urine meant it was in good balance, then a darker colored urine meant lesser water intake, right? That's true. But remember that this doesn't mean that you're severely dehydrated, but it is a reminder that you should drink more water. If you're taking some kind of medication, then it is also possible that your urine might be dark yellow, but an infection might also make the urine turn dark yellow. Number 5. Orange urine. Have you ever heard of orange colored urine? If you haven't, believe us when we tell you that it is not a good sign of health. A very obvious reason could be that your body is dehydrated, and it's time for you to increase your water intake to stay healthy. Another reason could be the different additions to your diet that could be altering the color of your urine. You heard that right, because different foods can make your urine change its color. Even when you take certain supplements for your health, you'll notice a change in color of your urine. For example, taking vitamin C or vitamin B12 supplements could change the color of your urine to orange. Number 4. Red or pink urine. Just like food can turn urine orange, it can also turn it red. For example, if you eat highly pigmented foods like beets, don't be surprised if your urine is red or pink. This is not an uncommon occurrence, and it has a name of its own, called beeturia. According to one study, this happens to around 10 to 14% of the population, but gets more common if one suffers from anemia. However, you shouldn't think that right after you stop eating beets, the color of the urine will go back to normal, because red urine can also appear if you have blood in your urine, which is a condition called hematuria. Hematuria can happen because of many conditions, such as sickle cell disease, a kidney infection, a urinary tract infection or UTI, cystitis where the bladder is inflamed, an enlarged prostate, and even cancer. So just as coughing up blood sounds serious, finding blood in your urine making it appear red should also be taken seriously. Number 3. Blue or green urine. Just like beets can turn urine red, blue or green pigmented food dyes in foods and even medicines can turn your urine blue or green. But blue or green urine could also point towards something serious, such as a urinary tract infection or UTI caused by a bacterium called Pseudomonas aeruginosa. It produces a blue-colored toxin called pyocyanin. Green urine, on the other hand, can be caused when blue pigment excreted by the kidneys is mixed with the normal yellow color of urine. It has also been reported to be caused by different medications such as Listerine and promethazine. Number 2. Dark brown or black-colored urine. Dark brown urine could mean that you've been taking medications such as Flagyl. However, for people who exercise a lot, the color of their urine could also turn dark brown, because the body expels some red blood cells through urine after intense exercise, and the color can go back to normal after some rest. This is called exertional hematuria. However, blood disorders or liver diseases could also turn your urine dark brown, so don't take it lightly. As for black urine, it can indicate that the body suffers from a rare condition called alkaptonuria, where it is unable to break down 2 amino acids called tyrosine and phenylalanine. Another reason for very dark brown or black urine could be rhabdomyolysis, where the muscles break down and release myoglobin, giving the urine a dark color. Number 1. Cloudy urine. Cloudy urine could mean that you don't drink enough water, have a UTI, or have preeclampsia during pregnancy. Moreover, a bubbly appearance of urine indicates dangerous diseases, such as Crohn's disease or diverticulitis. All of the diseases mentioned above need to be treated differently, and while you may not understand the cause of these, you can definitely check your urine's color and immediately consult a health professional to make sure you played your part right. This would require you to notice a color change, and hopefully, with the help of this video, you can connect the dots better. If you would like to see more videos related to health and wellness, make sure to subscribe to our channel so we see you back here again soon.